We are going to give folks a moment to get into the room. Okay. We had quite a few registrants for this session today, so we are going to give everyone a minute or so to get in. Just looking through the list here. Yep, so the number keeps rising. So until it comes to like a little bit more of a crawl, we'll keep it open. I really should be like playing music, just do some DJ Frank stuff at the moment. All right, looks like it's coming to a crawl. So we'll get started. Thank you all for joining us today and joining us for our Every Other Month Be Informed series. We are excited to not only come together today to, like we do every other month, but specifically talk about social media. As I almost always do, I forgot to introduce myself. I am Frank Hood. I'm the director of Hep B United, which is a coalition that yeah, my goodness, sorry, I'm having tech issues over here too. I'm Frank Hood. I'm the director of Hep B United. We're a coalition of coalitions based here in the US that really helps to provide those working on hepatitis B on the ground with the resources and information they need in order to better raise awareness among the public and providers in their community, as well as really tackle individual issues, whether it's access to treatment or figuring out how to get something implemented within their program, community, hospital, health system, so on and so forth. We are excited to say that we have 60 members now. We added 2 more this last week. 60 members in 39 cities and 27 states plus DC all across the country, and we are in our 13th year. The Hep B United is co-run by the Hepatitis B Foundation and the and APCHO, which stands for the Association of Asian Pacific Community Health Organizations. And this Be Informed session is one of the capacity building programs that Hep B United puts on. And we actually launched it last year. We put on webinars, typically monthly or every other month, but those can kind of be wide ranging and don't necessarily follow the same format. With Be Informed, we wanted to create a session that folks coming in knew that they would be getting some sort of heavy hitting information and a lot of information in a short period of time. And so we tend to follow the same format, which is a key speaker. Today we have Anika Martin from Hep Free Hawaii. And then we follow that up with sort of a case study or some sort of example or other example to sort of give context to what the speaker has said. So today I'm excited to bring one of my colleagues to the session, Monique Benvenuti, who is our oh my goodness, Monique, I totally just blanked on your official title. I'm sorry. I just say comms guru. So I think we can just say comms guru. But really does help us both at within the foundation, but also some of our other entities really run our social media. And that means not only like scheduling tweets, but actually thinking through kind of longer campaigns and how our different social media pieces can tie into one another to raise different programs stature and information. Because we are in a webinar setting, or in a webinar setting, we don't have the ability for folks to come off mute. So if you have questions, please submit it in the chat or the Q&A box. We in fact ask that folks do that just throughout the presentation because our speakers could potentially be able to answer it on the fly or type in and respond while the other speaker is speaking. And that just also gives everyone an opportunity to get more information in. All right. Move forward. Oh, I talked about what Be Informed is already, but there's some more information. So today we are coming up to our end of our 5 minutes. And I'm going to turn it over to Anika here in a minute, and then she'll turn it over to Monique when she's done. And then afterwards, we will come back together to have further discussion, conversations, and verbal answers to your questions. So again, please do get those submitted. Social media and comms manager. I don't know. I like comms guru better, Monique. So with that though, I will turn it over to Anika. And are you running your slides or Shreya?
Shreya will be running my slides for me.
Great. So then I am off, and then I will go on mute. So turn it over to you. Thank you.
Thanks, Frank. Alrighty. While Shreya is perfect. Thank you so much, Shreya. You're awesome. So hi everyone. My name is Anika Martin. I am the Awareness and Education Work Group Lead for HepFree Hawaii, a local coalition dedicated to eliminating hepatitis by 2030 in the state of Hawaii. So today, as Frank said, I'll basically just be talking about HepFree Hawaii strategies to building a digital community by leveraging social media. Before I get started, I wanted to just set a disclaimer. I am by no means a social media influencer, nor did I go to school for social media or any communications of that matter. I'm simply someone who's just fascinated about social media and how the digital world affects our abilities to promote healthy behaviors. So Shreya, can you go ahead to the next slide? All right, so why social media? Oftentimes we hear a negative connotation towards social media, like we're too reliant on it now. But honestly, I believe that social media can also serve as a benefit when trying to communicate messages widely. We live in a time where things are primarily digital now, so why not have health information included? So first, it stops people from having to physically go somewhere for support and resources. Who would want to call their doctor or have to make an appointment with a provider for a simple question like, where can I get vaccinated for hepatitis? The amount of time to research a list of vaccine clinics would probably take way less than you having to physically go to your doctor's office or even calling them for a list of clinics that provide that service. Second, you're able to connect with a larger audience. It takes so much work to conduct in-person conversations to promote your message. Instead, why not post your messages online for people even outside of your network to access? Third, you build a digital community of supporters. I'm going to tie in my fourth point here as well. If you're trying to mobilize action, whether that be asking for testimonies for a bill you want to be heard in your local leg session, or sharing a campaign to increase awareness about something, you want to have as many supporters as possible, both physically and online. So with that, you can mobilize so many actions when you're addressing more supporters that way. Next slide, Shreya. So what is pop culture and why do I have to mention this? I'm not going to read the entire definition, but in a nutshell, pop culture can briefly be described as what's popular or what other people call nowadays trending in society. So it's important because a community identifies what's popular. And honestly, let's be real, popular things just get more attention on social media. So when you're tailoring social media content as much as possible, try to incorporate pop culture in order to just gain more traction. So for example, we know getting tested for HIV and knowing your status is important to prevent transmission. We know that's important. But take a look at these two graphics. Both have similar messages, but what do I gravitate towards? The graphic on the left communicates loud and clear what I need to do. But the graphic on the right is what influences me to actually do something because I personally am going to follow what one of my idols say. Next slide, please. All right, so I wanted to just briefly show our numbers and followers and engagement across all of our platforms. Getting data is important and something our coalition really values. To be fully transparent, we just started collecting them last year. So we've compiled our 2023 data and consider it to be baseline. And as we continue to post in 2024, our hopes are to compare our numbers with 2023 in the future. But some important notes to include: Facebook, Twitter, and Instagram are our highest highest utilized platforms, hence the large following numbers. We post pretty often on these platforms, about 4 to 5 times a week. So we're posting much more regularly than the other ones. TikTok and LinkedIn are pretty new platforms that we've started just last year, hence the smaller number of followers. We post about once a week on TikTok, and every so often, if a publication comes out from one of our supporters that we share on LinkedIn. And last, YouTube is a platform that we share our storyteller videos on. But once again, we don't post as often as we really do with the others. To give you an estimate, maybe 1 to twice a year with a new storytelling video, since those are pretty lengthy. Next slide, please. All right, so you're thinking about social media to communicate your messages. Where do you start? Next slide, Shreya. First, identify your brand. Identify what you stand for, what your messages are, and who you're trying to communicate to. If you plan on developing graphics, think about what defines your identity, colors, specific logos, fonts. It's important to also be consistent with these, just because it links your organization with those colors and fonts. And then also, what personality are you trying to portray online? Are you trying to be super formal? Are you trying to be informative or super fun and laid back? Just think about that. Next slide, please. So here are just some examples of how we stay consistent with our brand. We really try to stay consistent with our colors on our logo. So a lot of orange and green. We also try to incorporate rainbow and tropical pieces in our online documents as well. On social media, we use hashtags so that when our consumers are clicking the hashtags, you're welcomed with all things wonderful with Hep Free Hawaii. So take that, hepatitis and Hep Free 2030. Those are hashtags we use. That's the one with the pound symbols. Those are mottos linked directly toward our vision and mission. And Hep Talk is a hashtag we're currently using for TikTok videos so that people can see where our videos are when you click that hashtag on TikTok. Next slide, please. So you also need to identify who you're trying to reach. So think about gender, age, lived experiences, racial and or ethnic backgrounds. Your messages would be more received if it was more relatable to that specific audience. And I'll go into detail why that means so much. Next slide, please. Here are just some of our influential individuals that we have on our followers list. Our followers include a lot of our consumers, so people maybe with lived experiences, partner alliances, so organizations that probably have the same vision as us or collaboratively partner with them, representatives to help us with our advocacy efforts, providers, and so many more. Next slide, please. I also want to note that different platforms have different features. So for example, YouTube allows you to post longer videos as compared to Instagram, whereas Instagram allows you to post shorter videos, pictures, or even conduct survey polls on like your little stories. That's really fun. So with that, it's just really important that you think about the types of content you want to post and see which platform allows for that content. Next slide, please. All right, so as mentioned previously, your messages would be so much more received if it was more relatable to the population and actually used by the population you're trying to target. So here's a really good graph that I found online. It basically displays the age demographic within each social media platform. I know it may be a little bit small, but take a look at TikTok's demographics. It's primarily used by 18 to 29-year-olds. And think to yourself, would you post the same content across TikTok and LinkedIn, knowing that LinkedIn has primarily 50 to 64-year-old individuals using it? Probably not, because it won't be received the same. So I'm not necessarily saying you can't post the same content. I'm saying to tailor your content. So you can definitely have the same message, but communicate it differently across your social media platforms, and so that it's more suitable to the population you're targeting and accessible for the population that actually uses it. Next slide, please. Now, You identify your brand, your audience, and your message. Now what? What do I do? Next slide. Get organized. Figure out who's posting. Social media can be such a large, daunting task, and I know people are like, "You're just posting." No, it's a lot. It's like another part of a job. And especially if you have so many other platforms, it can be extremely confusing when you have too many people on social media, and kind of problematic when you have to share usernames and passwords with so many people. So personally, I'd suggest identifying maybe 1 to 2 individuals that have the capacity to plan and organize the content and engage on the platform pretty regularly every week. That brings me to my next point of scheduling and planning out your content. Do yourself a favor and plan out your content. Doing this will avoid the stress of having to post something you don't even know is relatable or even engaging. I personally just take maybe once every 2 weeks, and use my Outlook calendar to just schedule some time to prepare my content. And then you could also actually use platforms that have that feature to schedule ahead. So platforms like LinkedIn, I know, is a very good platform that you can schedule your post on one day to post on another day at a specific time. That way you don't have to worry about doing it in real time. There's also apps and websites that could also link your social media accounts to allow you to prepare your content ahead of time and post when you want to. So those are just little features that you can do to help yourself get organized. Next slide, please. All right. Collaborate and work with your partners to get both of your messages across. Always, of course, ensure that you folks support each other and have the same mission and vision. You don't want to be promoting a message you don't absolutely agree with. So just establishing that. If you and your partners both have the same values and have the same goals, you can expand your messages by sharing each other's content or even creating content together. That way, both of your follower lists are exposed. Next slide, please. So here's just some general ways we collaborate with our partners, both nationally and locally. The two on the left are some TikToks that you can visit. Our wonderful co-director, Thaddeus Bang, went to the Hep B reunion and was able to develop some fun TikToks. And then the graphics on the left were just some images in support of our World Hepatitis Day campaign, along with just some other providers that help us, to eliminate hepatitis by 2030. So yeah. Those are really fun. Next slide, please. All right. Lastly, your audience needs to know that there's someone behind the screen. And believe it or not, your followers want to know that you appreciate them. Let's be real, we do appreciate them, because without your followers, your messages wouldn't even be received or shared, right? So engage with your followers just as much as they do with yours. You can also encourage engagement by getting them involved, by doing those little polls and surveys that are fun on Instagram and Twitter and stuff like that. Yeah, so those are really cool ways to really engage your followers to further engage with your platform besides just liking and sharing and stuff. And then lastly, have fun and show your personalities. Once again, make your followers understand that there is a person, there are people behind the username, not just an AI person just posting whatever they want to do. So do that. I'll go ahead and to the next slide, Shreya. So in Hep Free Hawaii, we humanize our platforms by sharing photos and videos of real faces. We try not to post so many graphics with just words. We're finding that our followers really like seeing our community members and our providers' faces. It just really makes it more personable. So yeah, some people that we share are our community members, local partners. And then the 2 videos on the left, those are those still shots from our TikTok. We really just try to showcase our fun well, I like to think we're fun. I think we're a lot of fun, but yeah, we try to showcase our fun personalities while also increasing awareness about hepatitis. Next slide, please. All right. So let's summarize what we talked about. If you're interested in building your digital community, start with a baseline of identifying your brand and your platforms. Once you do that, get organized and figure out who's posting and when to post. Third, engage with your partners and followers to increase engagement numbers and message communication. You can do this by collaborating with them to create content, or just sharing with each other some content that you'd like each other to post, things like that. And last but certainly not least, again, have fun. Social media is supposed to be super fun. Smile, show your face, show your personality. That's what really gets traction. Next slide, please. But basically, that's the end of my presentation. I encourage you all to follow us on all of these social media platforms. Everything is at HepFree Hawaii. You can also find these on our website, hepfreehawaii.org. But feel free to let me know if you folks have any questions. But otherwise, thank you so much for listening.
Thank you. Just a reminder, if you all have questions, to please put them in the Q&A box there at the bottom. And we are just going to keep trucking right along. I will turn it over to Monique, who's going to talk some about how we handle our stuff at the foundation.
Thanks, Frank.
Monique, please give me a minute. I'm pulling it up. I'm pulling the slide.
Sure. I'll go ahead and introduce myself again. My name is Monique Beminuti, and I am the Social Media and Communications Manager for the Hepatitis B Foundation. We are a global nonprofit organization dedicated to finding a cure and improving the life for people affected by hepatitis B. I'm ready if you are, Shreya.
Can you all see it?
Yep.
Okay.
Thank you. So today I'm just going to talk about some social media tips for bringing awareness and building connection and growing your organization. Next slide. Thank you. So how can a small shop make a big impact? I work alongside the Director of Communications and Marketing for the foundation. But even though there are just two of us, we work very closely with our coalitions and partners to build something called, I like to call a halo effect, where you can connect with key partners by following them and tagging them on specific social media posts. But importantly, to continue that by liking and sharing their content and social media posts. Additionally, I try to do this for every post, is to use specific hashtags. Hepatitis B and Hep B are very common hashtags for us, but we have a very robust storytelling program, and that hashtag is just B, and we also have a Be the Voice storytelling program. So hashtags are very helpful to connect audiences when they're searching for specific topics. Faces for connection. Like Anika said, photos are so important, but as social media has evolved, videos I think are even more important than photos. So sharing posts with photos that can connect with your audiences, that they feel like, you know, that person looks like me, talks like me, is so important. And like I said, videos are even more important, I think. Videos can be very simple. They don't need to be fancy in production. A lot of times I've used my cell phone to record a video, but you can still provide very high value content, not just to promote your organization, but just to give your audience the education that they need. And then additionally, timeliness is so important. Just to be prepared with a schedule and build a library. The Hepatitis B Foundation uses an annual advocacy schedule per month, and then we build upon that each month. Next slide, please. So how can a small shop make a big impression? So as you know, social media is just ever changing. Trends are constantly evolving, but it's important to just keep in tune with them and to be creative. But probably most importantly is to just be tech savvy, where you can connect information that you're building on a newsletter, on your website, an event or anything like that. Connect them all together to share any relevant topics or what's happening on your social media platforms. And then brand consistency, where you have templates. I like to keep my content clean so that people don't feel overwhelmed, and that they actually can understand what's going on. And what I mean by clean is just like, very clear, your logo and your color scheme. I probably build a more consistent brand on my website. Social media, I'll play with a little bit more with more colors and things like that, depending on whatever theme that I'm sharing on. Next slide, please. So how to use your time effectively. I use a monthly social media calendar where I'll call it my social media outline. A lot of that content can be recycled, so it's important to have all of your social media organized per month, and then it's accessible to all of our coalitions and team members that they can share on their platforms as well. I use a scheduling platform called Hootsuite. It's wonderful when it works. Sometimes I do have some glitches, but Hootsuite is very wonderful. You can schedule, honestly, you can schedule your social media out for a year. I schedule probably 3 to 4 times a day on each platform, over 100 posts a month. So using a scheduling platform is very, very helpful. Not just for repurposing content, but we have a library called Evergreen, so full of evergreen posts that we use primarily for educational purposes, for simple topics like, how is hepatitis B contracted? How do what do I do if I have hepatitis B and I'm pregnant, and things like that. So just evergreen educational items are very informational, that we share on a daily basis, usually early in the morning. And then for design, I use a platform that's very widely used called Canva. And I use this to build our social media posts through graphics, but also you can use it for video production. And just so you know, a basic Canva account is free, but you can upgrade to professional accounts as well to just give yourself some more stock photos and different templates. But even the free account has a ton to use. And next slide, please. So how social media toolkits can help. Our organization hosts a lot of special events, and we promote a lot of monthly themes. So building a cohesive social media toolkit is very crucial to share with all of our coalitions and partners so that we have a cohesive theme that we're sharing together. For instance, we have a team of runners that run annually for the New York City Marathon. It's a huge event, and it helps raise funds for our organization. So we build a media toolkit for each runner so that those runners can share their posts to promote the event as well. So one toolkit expands into so many different individuals sharing them. And it's important to share the source of information in your posts. So for example, if there's news or updates from the CDC, it's important to share where you're getting your information from. And probably something, the next topic that is probably the most crucial is just diversity. We tie very deep into our data each month just to see where our audiences are coming from and what kind of information are they seeking by sending questions through our Facebook platform to see, just get information about hepatitis B. So then we use that information to build a campaigns that are very inclusive and culturally sensitive. And something that we look to evolve upon very soon is to share posts that are translated into many other different languages who are tying into our social media platforms at the moment. Next slide, please. So how social media platforms differ. Our organization currently uses 4. We have Facebook, X, formerly known as Twitter, Instagram, and LinkedIn. For our Facebook platform, we have most of our audiences are of people living with hepatitis B or who have family and relatives of people living with hepatitis B. And this is a very important, probably our most important platform, because this is how we connect with them through, we have a professional who responds to our consult line. People every day will just through comments and messaging ask for information about hepatitis B. And then we use those frequently asked questions to build our social media. Twitter or X is very news oriented, and a lot of key influencers use it, like Dr. Sue Wong and Dr. Bob Gish. Instagram is probably my favorite, where you can share awesome photos and videos to connect with your audiences. Something that I try to do regularly is share stories on our Instagram platform. And if you'd like to, you can connect your story posting to automatically get shared to Facebook as well. So if we have something like a new blog or a great new topic to share, we'll also not only share it in a post, but also through a story. LinkedIn is a great platform that we connect with a lot of professionals and networking on that platform. Although that platform tends to be for professional reasons, I do share information where medical professionals can share with their patients, for instance, like a media toolkit or something like that would be helpful for a medical professional to share. And then although there's other platforms such as TikTok, Pinterest, and Snapchat, we don't use those yet, but we have been in discussion of possibly building a TikTok platform soon for our foundation, full of very robust videos. So stay tuned for that. And next slide, please. Just some things to remember. It's always great to have an extra set of eyes for someone to review your social media outlines or any posts or any kind of new topics. So just having someone take a look at it and any content that you have is very helpful. I try not to flood the zone. Sometimes less is more, and I like to space news out so that it gives our audiences time to catch a breath and just kind of process information that we're sharing. Simplicity is very good, where like Anika said, I try not to put too many words in a graphic. Instead, I'd like to put a blurb that would connect audiences to our website so that they can gain a lot more information from there. Importantly, one post can grow into so much more. Interesting, I like to look at our top visited posts each month, and sometimes I'm surprised at what posts audiences really connect with and like and share the most. But like I said, one post can grow into so much more, so it's important to like and share your posts and your partners' posts and posts of your coalitions. But on each post, it's important to draw traffic to our website so that people can gain information, more information that they are looking for. And last but not least, it's just so important to have fun and to develop a voice of not only your organization, but most importantly, the voices of people living with hepatitis B, and when possible, to share posted videos and photos that are kind of raw and real, where you feel like your audience can actually connect with whatever initiatives you're trying to work on. And that's all I have today. Thank you so much. Thank you, Shreya.
Thank you, Monique. Thank you, Anika. And we had, I saw some questions pop in, but Anika was like answering them all pretty quick as things were coming through. I did, though, want to come back to one of them. Give me a moment. I will find it. So Philip, you asked, do you ever pay for boosts or other extra reach on any of the platforms? And if so, what's the best strategy you found for doing that? So Hep3 Hawaii does not, but we at the foundation do. And Monique, we do it though because we got a little bit from Google to play with, if I recall. But can you talk about how you and the comms director Ed kind of determine which posts to use that on? And
Sure.
also, I don't know the inner workings of it, but is this something that any of our nonprofit colleagues can potentially tap into?
Sure. So for the Google ads, we do have a grant that we do promote specific initiatives, but on social media, we do boost specific posts through ads and things like that. For instance, we did like a clinical trial survey. Thankfully, we were able to track funding through a grant for those ads. But I use Facebook for Google or for Facebook ads, and you actually can. I've done a few on Instagram as well, and LinkedIn, which probably isn't the most relevant for people living with hepatitis B, but LinkedIn also does have the option to promote ads. And it's, to be honest, it's not very expensive. It's very cost effective, and you can target your audience and your population dates, region, everything. You can add in key terms and have it very tailored to a specific audience if you'd like.
And generally see do you see like a improvement or an impact on those boosts? Yes. Okay. You saw the wide eyes there. Anyone who wasn't looking at the screen, that was very much a yes.
Yeah, we did a survey the end of last summer, and we were initially we were getting a lot of responses from English speaking, and we really needed some responses from non-English speaking as well, so that the survey was relevant to the research being done. So then once we boosted the ad in specific regions, then we saw an increase in survey responses that we needed.
Got it. I don't see other questions that have popped in yet. Oh wait. Oh, and she answered which platforms have grants. I had a question. Anika, you showed the slide with engagements, and I was curious what your definition of engagement was.
Great question. So different platforms have different definitions of them, but for the most part, engagement is liking and sharing the content. But again, that could be different because that is relatively to Instagram, but like for TikTok, that's like views and likes and shares. Yeah.
Got it. Okay. And then it was so funny because I wrote down like different platforms equal different audience, and then you went into how it was tailored. But I am curious because I think you both touched on cross-platform posting, and Monique, you specifically mentioned how you can cross-post between Insta and Facebook, kind of with the click of the button. What are there cross posts that the materials kind of generally work well on? You're generally like, I can post the exact same thing to Twitter as I can to Facebook. I mean, where are those sort of connections if someone's really trying to, I don't want to say cut a corner, but just like potentially be able to really maximize minimal changes for maximum social media?
I personally cross post with Instagram and Facebook, like what Monique mentioned with that click. You can just link both of the accounts together. They seem to have the same audience and kind of gravitate towards the same content ideas. Same with Twitter too, I find that. But I don't really cross post often with LinkedIn and TikTok because those are the two platforms that have very different audience users.
I've got a quick follow-up question. The TikTok is video. Do the reels not kind of go into like Facebook and Instagram as well?
They do. Yeah.
Oh, so you can do like TikTok. Okay.
Yes, yeah. So I cross post my the TikTok content with Instagram and Facebook, not so much Twitter, because I was
Weird.
finding that the videos weren't really getting as much engagement as far as like just general posting.
Got it. All right. And for the foundation, Monique?
So I cross post a lot with Instagram and Facebook, but then Twitter, Twitter's its own being. So just very short content. I do share a lot of like our news. We use a lot of news updates from Google that we share internally, and then I build that content and share it on Twitter. I do share news on LinkedIn as well. We get a lot of it. Our LinkedIn has gone crazy this year. It's like doubled in following. So it's just, I think we've just tried to share a more robust content on LinkedIn, and we're getting a lot more followers engagement, because I think LinkedIn's changing a little bit to it. Many years ago when I first started using it, it was like people were just looking for a job or networking, but now it's like kind of like a professional platform where you can discuss other things and initiatives on there too. So
Yeah, I will say, Monique, that for the United, it has been, even in the last 2 years, a shift on the amount of just information and networking that can happen kind of through LinkedIn, and how engaged folks are. Because I mean, I know that I was kind of the same thing. Like when I was working, didn't need a job, I didn't go on LinkedIn all that much. It was sort of just like when you went and updated your resume, and now it's, I mean, there's just some really good information on there. So I had another question. In your presentation, Anika, you mentioned humanizing your posts, and actually Monique also followed up on it. But I was curious if you had any tips on how to. You also mentioned, like, are you going to be professional, formal, super cheeky? How do you humanize professional? Do you have a good example for those of us who might not know kind of how to walk that line?
No, that's actually a really good question. So I don't want to say Humphrey Hawaii is not as professional, but no, we have a very happy and cheeky personality on as far as our digital presence goes. To give an example as far as how to humanize a more professional person or content of some kind, one example could be, say, if you're working with a provider, simply just asking them to take a video of the message that you're trying to communicate and have that provider take that video, or have that provider actually communicate it. I feel like that would humanize the platform so much more than just having their picture and a quote as a graphic to post it on, I don't know, Instagram or whatever. That's one of a key example that I would say.
Awesome. Monique, you got anything comes to mind?
Yeah, I mean, we definitely, like I said, host a lot of events and things like that. So that's an opportunity to share professional posts, but then, for instance, like Giving Tuesday, where the president of our foundation we did a video short, instead of, like Anika said, just a picture and a graphic asking for donations. Just a video short of a heartwarming message. And if anyone knows our president, she's very easy to connect with and engage with. And so her message to me was just so wonderful and very humanizing. And our initiative did really well because of that.
Nice. Thank you. And actually, it almost sounds like sometimes in those professional settings, pulling out the humanizing card just, it has an extra impact because of kind of how different it hits compared to the normal content. So we usually we try to wrap up about 10 minutes early, just give folks some time. So we still have a little bit of time for Q&A if others have questions. Monique, I had a question I wrote down for you. I know the answer to this question, but I have to ask it out loud so you can answer it. You mentioned usually you kind of follow a monthly theme. How do you determine, two questions. One, where do you find the PEP Awareness Month information or Liver Cancer Awareness Month information? And secondly, once you know that a certain month is being celebrated around a certain topic, kind of how do you go and determine that's the theme for the month?
It's tricky because we are an international organization, so I try to base our themes off of International Awareness Months through searches and through a library that we have within the foundation already. Sometimes we will share on national themes, but make sure that the content is relevant to other audiences outside of the United States as well. For instance, like Alcohol Awareness Month is a national theme, but that can be relevant to other countries as well. So just then tie in, photos and videos of people who live in other regions as well. But definitely across the board, we try to focus more internationally.
Okay. And then determining your choices though, I will say I set you up and sorry. Ed and Monique are the first item on our weekly agenda. So Monique and our comms director, like whenever the foundation comes together weekly for our Tuesday afternoon all staff check-in, that they are literally the first things after hello. And so that is where each week it'll come up, be like, oh, our topic, our next month or a couple months from now is such and such awareness month. Should we proceed with social media, so on and so forth, and that's where we talk about it. So
it's definitely not pulled out of a hat. There's an annual schedule that's planned and approved by leadership. So our foundation has a specific plan for annually that we use already. Of course, if anything changes, like Naira Day or something like that, we'll build that into our schedule. But it's definitely not random, and it has to be tied into hepatitis B, of course, and internationally, if that makes sense.
Yeah. And to the point earlier, Monique's point earlier of asking colleagues for input, that is the agreement. Monique and Ed will elevate things that we're like, oh, we need help elevating this, but we have to turn around and actually also provide those eyes when they ask for it. So, so we have just the last couple minutes. I was gonna say any last final suggestion or tip or anything else for folks doing this work as we wrap up? If not,
sure, I'll go first. I think for me, something that I can't stress enough is that your social media is important and great, but also just try to tie in everything else that you're doing as well, like your website, your blogs, your podcasts, and try to engage your audiences with everything you're doing through social media, instead of it just being like a source of information via social media.
Anika?
Yeah. Yeah, I think that was actually a really good point, Monique. I think I would also agree. As much as you can, again, social media can can target so many people, and can access people outside of your in-person network. So I'd really encourage you folks to tie everything together by social media. Social media is such a powerful tool as far as really engaging a huge audience. And that is primarily how people are utilizing social media nowadays to communicate their messages. Another really important point that I also wanted to say is just, again, have fun with it. It doesn't have to be so formal and nerve-wracking. As much as possible, try to encourage your staff, your colleagues to also get involved to creating content together. Not only will you get really cool content, but you'll also just build a really good team of people who have the same vision as you.
Solid. My wife is not working from home today, so I don't have to say this, but I will. My wife is a comms professional, and the thing that she has preached for years and years is that comms should always be in the room. And so what she means by that is if you happen to have an organization that's lucky enough to have one or multiple communications people who help direct messaging, who help craft messaging and then get it out the door, If you are sitting and having a conversation about messaging and they are not there, they cannot do their jobs effectively. So make sure that when you are crafting messaging, that your messaging experts are in the room, because they will help you oftentimes be like, oh, yeah, that's a good message, but it's not going to fit well on half of our social media sites. So how can we shrink it to something that actually like hits? So that will be my internal suggestion or tip. Well, we are at 10 till. This is when we wrap up. Thank you both so very much for taking the time out and having this great conversation. This was not only informative, but also just like fun. I mean, this was fun. I feel like for stressing that social media should be fun, you made it a fun presentation. So way to go. We had multiple questions about if this will be posted. Yes, we'll have the recording up on the Hep B United website. We'll make sure to get whatever slides we're able to use. And we try to post them within a few days of the session, and we also will make sure there are links on our newsletter, so keep an eye on that. Our next Be Informed session is on May 21st at 3 p.m. Topic and speaker to be determined. We have other ones for later in the year sorted, but that May one keeps getting shifted on us. But it will be May 21st, and as soon as we have our topic and speaker finalized, we will send that out. But otherwise, thank you again to our speakers and to all of you for attending, and we look forward to seeing you in a few months.
Thank you.